This is the Lyndsay Stafford Show.
Welcome back to the Lyndsay Stafford Show. This is a special episode featuring our partners at Bone & Joint. In today's episode, I have Roger Blandford here. Roger is a physician's assistant in orthopedic urgent care with Bone & Joint. And Bone & Joint is such a pillar in our community. When we do these episodes, I like to share this because I don't think everybody knows what they do for our community. Bone & Joint provides athletic trainers for all of Williamson County high schools, and they actually are now doing that at Stewart's Creek as well in Rutherford. So they are an extremely valuable asset to this community, and one of the ways we like to show them is by featuring them on our show. So welcome to my show, Roger. Happy to have you.
Thank you. Thanks for having me.
Yeah, so tell us a little bit about you and how you got connected with Bone & Joint and what you do.
Well, as you mentioned, I am a certified physician assistant. I've been involved in sports medicine, since 1992.
Okay.
Starting out as an athletic trainer, did that for quite a while and just felt I plateaued in my career. So I'd worked very closely with the physician assistant with the orthopedic group. Seemed like a logical choice and went down that pathway. Always been in sports medicine. That's kind of my thing. Like you mentioned, Bone & Joint's heavily involved with that, with the community, and that's the kind of group I like to be a part of. So all the groups I've worked with, we've been involved in the community, taking care of high schools and the athletes, doing physicals, and that's usually what I look for, an employer, and that's kind of wound up at Bone & Joint. Plus, a great reputation, that's something that's always important to me because I want to make sure that I can recommend the doctors, and I'd go to them myself. So
yeah, Bone & Joint's incredible. I can't say enough good things about Bone & Joint. So have you always been in Tennessee?
No, I've kind of worked through the Southeast from Florida. Went to the University of Florida and worked there for a while. Then moved up to Atlanta, was in Atlanta for several years. And Tennessee is a much more, they utilize physician assistants for their full potential much more than other states. North Carolina, Texas, and Tennessee do a very good job with this. And the opportunity to come here into Tennessee and utilize more of the full potential of my skills as a physician assistant was what brought me here.
Oh, that's great. So how long have you been with Bone & Joint?
A little over 2 years now.
Wow. Well, I will warn you, I've heard that once you get into Bone & Joint, you never leave. So I guess you're home forever.
Well, it is definitely much better than my last employer, and I've been very happy so far. So yeah, no intentions of going anywhere.
Yeah, I think
recruiters call and I'm like, don't call me anymore. Yeah,
don't waste my time. I love where I work.
Exactly.
I love that. Well, you spent more than a decade as a collegiate athletic trainer before becoming a PA. Tell us about what that experience taught you about injuries that maybe most people don't understand.
Yeah, well, it really taught me types of injuries and also being able to look at it as a large picture, not just evaluating, but also rehabbing it so you can better educate the patient about, hey, this is what's going on. This is what you have to do. This is how we get you better. It also really educated me about what we call overuse injuries, which you do see a lot in athletics.
Yeah.
And those can be a little bit tougher to deal with. But with that knowledge, it's really helped with transition, the PA, especially in orthopedics as well. So it's really been helpful there. Also, the teamwork aspect of it, because as an athletic trainer, especially collegiately, we have a very large team, not just the actual team, but physicians, nurses, athletic trainers, then physical therapists, everything from psychologists. So we're all working as a group to put the best team as we can out on the field and also take care of these guys and gals to their full potential.
It's kind of like Bone & Joint has like this deep bench of people like on the sidelines.
Yes.
Because you guys just there's someone that knows the answer to whatever the problem is.
Plus with our subspecialties that,
right.
If it's more of a spine issue or if we've got more of a shoulder or ankle, we've got those specialists you can call on. And that's the thing that's been really good about working with Bone & Joint is, even when I'm working on the weekend, I can call any of those guys and they, don't hesitate to pull up an x-ray, take a look, or just listen to what I've got and, give me advice as to what we do, with some of the more significant injuries.
It's incredible to have those resources. So when someone gets hurt, how do they know whether it's something they can walk off versus something that needs immediate medical attention?
Well, I think that's where you go into common sense. Do you see it in a weird angle?
Yeah.
That's kind of your first giveaway.
Probably don't walk.
Yes. Can you put weight on it? The simple answer there. The other thing I'd say is for people with young children, just come, because it's amazing how many kids can break something and just function normally or appear to function normally. And then you come and see me a week or two later and find out there was a fracture and you just feel horrible, even though everything's
Yeah.
okay. I just try to, I'd say, you got a little kid, they fell down a few steps, maybe give it a day. But if you see something's off, come in, because it's amazing what they can just keep going with.
It's funny because I've heard many stories like that
Yes.
from moms that say, I didn't think it was anything.
Yes. Well, it's because these kids they're too busy. They got other things to do. So they don't stop when they're injured. So I tell all of my young parents, I was like, hey, just come in, get a
Yeah.
picture. If I tell you it's nothing, then you just keep going. But if it is, then let's make sure we take care of it.
Yeah, it's that peace of mind, and better
Mhm.
safe than sorry.
Yeah.
Yeah, that makes a lot of sense. So you work in orthopedic urgent care. What are some of the most common injuries that you treat, and which ones are the most surprising?
Well, I think exactly what we were just talking about, the overuse injuries.
Yeah.
I think with just the way we are today in society, between everybody's on a computer, everybody's on their phone, and between neck, shoulder, elbow, hand, all these overuse injuries is what I treat on a daily basis. The bursitis, the tendinitis, we see a lot of it. And a lot of it's just education. Yeah, there's some that need a little extra help, but if you say, hey, okay, this is what's going on, this is what caused it. So do these things, add this in, change this behavior, and this should get better. The other thing too is we just talking about the young kids. They said, yeah, they fell down a couple steps, just on acting right. And you come back and find out, well, they fractured the collarbone, and, I get quite a few of these where they're just shocked. I had a young gentleman about a week ago. He did a backflip, just didn't stick the landing, still sore, comes in. He actually fractured his thigh, his femur,
Oh my gosh.
and his dad's like, okay, I wasn't expecting that, so then we have to, luckily it was well aligned and everything was okay. But yeah, we have to, definitely take better care of that, So you see those things all the time.
Yeah, I bet. What's been the most surprising?
Well, most surprising, I guess I don't see much. I've been doing this a while now.
Nothing surprises you?
No,
Hey, that's
no.
a good thing when you're finding a surgeon, or I'm sorry, a PA that has seen it all. There's no surprises. That's a blessing, right?
Yeah,
You know how to
the
solve them all.
yeah the one that I guess got me most recently, it wasn't even my patient. That's the other thing that's good about bone and joint is between colleagues we do share things. If you get something that is out of the norm, they say, "Hey, I just had this, wanted to share with you guys." And fortunately, one of my colleagues had a patient had a weird looking spot on an X-ray of their hip and got an MRI and found out it was metastatic cancer.
Oh my gosh.
And you wouldn't see anything on the X-ray. They just started having some mild hip pain, but that's the thing; it just hadn't really manifested anywhere else as a symptom. So unfortunately, that's how we found it.
But you find it, you guys can solve a lot of things, even if that's not what you were.
Yeah, at least
thinking.
you find it and you say, okay, hey, you gotta get this treated, and hand off to the specialist and let them go.
Right. Yeah, that's great. Well, prayers for that patient.
Yeah.
What injury myths drive you crazy because they're still so wildly believed?
Well, I guess that's so much an injury myth, but the one right now is that everything needs an MRI,
Mm.
and it just doesn't. The thing is, a lot of us and the surgeons, we went to school, we learned a lot, and we can evaluate a lot of things that do not require an MRI. And just because the X-ray is negative doesn't mean your ankle sprain needs an MRI.
Sure.
And so that's the thing is just, again, with our sport culture as prevalent as it is, these guys twist an ankle and they're getting MRIs, and you understand that he's a, $50 to $100 million athlete. Yeah, you're going to do that. But we know pretty well what's going on. Now, yes, you need MRIs at times to clarify, or if things aren't crystal clear, but not everything needs an MRI.
I love that. And I love the conservative approach of we don't have to prescribe something that, you know, is over prescribed in some areas.
Yes,
Right. And just go with trust your doctors. I
exactly.
want to go back to that last question for a second
Sure.
about common injuries. And I want to know, and this is, I'm throwing you for a loop here with this one, but do you have any tips? You talked about phone, computer, I imagine it's like neck, shoulders, even hands.
Yes.
Do you have any advice for listeners on this is what you can do to prevent injuries?
Well, again, it goes back to like we're all tied to a computer in some way, and in phones as well. And it does go back to the old adage, posture, posture, posture. Because that's a thing. If you're working 8 hours a day and you're stuck on that computer, your posture is going to suffer. There's
Yeah.
just no way to maintain. So, really, it's setting up your workstation as best as possible. Anybody that's working on a laptop, if you're mobile, you're stuck. If you're stationary, get an external monitor, because there's no way you can look down and stare at that screen and not develop neck and shoulder issues,
hmm
So I tell everybody, buy that external monitor, set it up, got to have everything eye level, have that keyboard and mouse close and tight to you as you can. And that's kind of a key thing to do.
Yeah.
So those are kind of things, but just think about it. You start feeling stuff getting sore because you've been working on a project for
Yeah.
6 hours. Stop, get up, walk around the house 2, 3 times, sit back down. Those
Stretch.
little things help
Mm.
out. Yeah.
So I was doing this with my phone. I was looking at messages and I was in a hotel. We were at a conference
Hmm.
and I was waiting for the elevator and somebody walked. It was at a conference. I knew a bunch of people and they go, "Are you taking pictures of people coming out of the elevator?" I said, "No, I'm just trying not to look down on my phone. I'm just
Yes.
trying to keep it eye level." And it was like such a phenomenon because everyone's looking like this. I'm like, I really try to keep it up. So I don't have an external monitor, but I do have my laptop sits on a stand that I can raise.
Oh, okay.
So I raise it to eye
Yes.
level. So
Yeah.
that's like $30 on Amazon or something.
Yeah. Yeah.
So that was, because I can't do this. It has to be up here. So good. I'm glad to hear that I am doing something right. And hopefully that helps listeners because I do think in this world, we're just so used to looking down and that is going to cause.
Yeah, and it does it over time. You may not know, even if you're in your 20s, you may not notice it for a few months, but do that long enough and you'll be coming to see me.
Yeah, exactly.
And even I'll be honest, even my girlfriend who works on a laptop a lot and she does move around, I bought her a portable monitor that plugs right in, but it comes in a case. It's a little 24-inch monitor that she can just it's got a bag and everything. She can throw all the other stuff in it and just take it with her.
Oh, that's great.
Yeah.
Yeah, just being conscious of how you're positioned, right, is so important. Okay, so youth sports have become increasingly competitive. My goodness, here in Williamson County, it's incredibly competitive. What are you seeing today that concerns you most about young athletes and overuse injuries?
Everything. The biggest problem is more is better. And the honest truth is the only part of sports that you find that is youth sports. You don't find it in high school, collegiate, or professional. They understand the value of off time. They understand the value of recovery. And in youth sports, we just don't get that.
Mm.
Um, we have enough data to fill this room about how everything's being done wrong. You should not be on multiple teams. And most of my kids are. They're usually, in season on another team. And usually, in addition, getting professional training on top of that. It's just too much. It's way too much. All the data shows that if you're a year-round athlete, which is more than 8 months out of the year, you have double the risk of injury.
Wow.
And that's supported by multiple studies. And we also show that athletes that are in a single sport year-round burn out faster, have the higher risk of injury, and also have decreased skill development compared to multi-sport athletes. You can do sports year-round. There is nothing wrong with that. We've done it for, centuries. But it's multi-sport because the multi-sport utilizes different skills that transition into all sports.
Mm-hmm.
So if you're playing soccer in the fall, basketball in the winter, baseball in spring, you're not adversely affecting your joints. You're not overloading the joints because you're doing a certain motion repetitively. You are developing the skill that you need to make you better at all sports.
Right.
Now, and what they say is when you get to your later teen years, that's when you should specialize. That's when you really focus on that one sport. But that doesn't mean you play that sport year round. You do have an off season. You do have a recovery. We know how to train people. There's all these macros where there's off season training, there's preseason training, there's in season training, and you follow these guidelines, which are well established, and you avoid injury. But just playing the same sport year round is just very debilitating to the body and to skill development, which is what they're trying to accomplish. Another stat I'll share, because baseball is one of our worst offenders.
I was thinking.
Yeah. There's a, not common, but a injury and a procedure out there. It's called Tommy John surgery. A lot of people have heard of it because it's devastating to a pitcher. We're to the point now with advances, you can recover and return to pitching. It's usually a 19-month recovery, even for a professional pitcher. We're talking 19 months. You can't speed it up. You are locked into that. Right now, 57% of those procedures are on adolescents.
Wow.
That's the stat right now. So think about that. That kids that haven't even really gotten into any part of a professional career or even collegiate career are having a life-altering surgery. And if, again, the name Dr. James Andrews, who's kind of the godfather of sports medicine, and he's fixed more athletes and saved more careers than really anybody, he started a whole movement to, literally stop these type of injuries. And you can find it on his website. Major League Baseball's adopted a lot of the things he's put out there right now. It's even on their website. But he said that was his main reason for starting this movement, is he was tired of doing Tommy John surgery on 13-year-olds.
Wow.
And that's simply an overuse injury.
Yeah. Well, the overuse, the competitive culture drives this need for more, this desire to do more, and just the culture that we live in. It's like,
yeah, and that is part of it is, and that's where I ask parents to please be educated about this stuff. And I've got all kinds of stuff I give out all the time and websites because it's readily available. Just got to know about it. Because that's what you find is kids get held hostage. That unless you're on my travel team, I'm the coach at the high school, kid's not going to play. And I've heard more than one story of that. And that's some scary stuff because, it's like, this is supposed to be for fun. It's just supposed to be, something they enjoy. And finding that kids are being held hostage, and that's the only way they're going to make their high school team is because they've got to play on this travel team is a little scary.
Yeah, it's the politics that
it is.
Get involved. We could probably do a whole separate podcast about that.
Yes.
Yeah. But I've got high school. My daughter graduated. She was a cheerleader, which is pretty intense year round. She was competitive cheer. And then our son has been a basketball player. This is the first season he took off, spring season, in like 8 years. He's 16.
Yeah.
And we were like, we need a break.
Yeah.
We need a break. We need a break. Your body needs a break. Go do boxing, something else, just no basketball. But I see kids go to practice. So they'll do lifting in the morning before school. And they go to practice after school. And then they go to private training lessons after that.
Yes.
And that's like 5 days a week.
Yeah.
And then on the weekends, they're private training and
or they're doing tournaments.
Yeah.
Yeah. And there's times where like I'm adding up the hours that they're telling me and I'm like, when do you go to school?
When do you do your homework? When do you sleep?
Yeah, like when.
Well, what do you think of that? Is that a schedule that's sustainable?
No. I mean, it just
I don't
isn't.
think so either, but
No.
I want to know what you think.
Well,
as
and
a
again, too,
professional.
if you don't, well, part of it too, again, think about it. So think of how we do it collegiately, because we do that. They lift in the morning, go to class, see us for rehab, go to practice, and then maybe they'll rehab after, go home, eat, and do all their stuff. But everything's coordinated.
Yeah.
We coordinate. The strength coaches know what the sports med guys are doing. They know what the instructors are doing. They know what practice is like. it's all one unit.
Right.
See, in that situation, you've got a private coach, doesn't know what they're doing at practice. You've got a coach at practice. I've got to maximize what I can do in these couple hours I have, and you just, there's no coordination of it.
Mm-hmm.
So the kid could have gone to practice and pitched for 2 hours doing a bullpen. Now he's going to go to private pitching lessons where he's going to do another bullpen.
Yeah.
And that's how you wear out these arms and what have you. And that's the thing, is it's not coordinated. Nobody's talking to the other. And I do feel that's part of the problem. Whereas, they're trying to say, well, it's the same as college or pros. Like, no, it's not.
That's an interesting perspective, because I hadn't thought of it that way, but that makes a lot of sense. What advice do you have for these parents that really are the ones making the decisions on how much their children are?
I really think
involved?
it really is just get educated about, how how does my kid become a better athlete? And there is readily information out there. Say, how do I prevent injuries? You Google that, it'll come up. MLB, if it's, again, we're talking about pitching or softball, on their website, they've got it's one of the tabs. You go to MLB.com, it's one of the tabs. Is there youth baseball? They talk about pitch counts. They talk about all kinds of injury prevention stuff that's right there, readily available. It's really about just, you've got to be educated about this, just like, don't trust the coaches. I hate to say that, but that's what you got to do. Some are donating their time and doing it. Others are well paid, and they're driving to win, whether it's their travel team or what have you, to build their own reputation. But you just have to be educated about what makes a good athlete. And, all the data's out there. We know how to, make kids better, stronger, faster. And it's not just do it 1,000 times.
Yeah.
you know.
I love that. Really, really good, powerful information, and just the resources that are available. I imagine for NBA and NFL, there's probably some similar resources out there for kids. I think for parents, sometimes this world is moving so fast, you have to be intentional to slow down, to research, to know how to guide. And sometimes we trust when we shouldn't.
Yeah. And I think that's a good point, is every once in a while just say, wait a minute, is this the right path?
Mm-hmm.
And try to find people that are good resources. And again, it is your true professionals that are involved in sports medicine, because they should know this stuff.
Yeah.
I know that our providers do, and they can give that information readily. Physical therapists as well that, spend a lot of time working with sports medicine. They can tell you about, this is what you do preseason, postseason.
Yeah.
As part of this, it's not grind.
Yeah.
Just there's only a few sports they've shown it works. Gymnastics, swimming.
Is the ones that you can just go.
That you kind of do need that kind of early start.
Yeah.
and training of that caliber. It's the only, when they do the research, there's only 2 sports they
Wow.
found where there is benefit. It doesn't mean that you don't have an off season, doesn't mean that you don't need rest, but that those sports, they do or have shown that there is some benefit to that.
Yeah.
Unfortunately, we're applying it to all sports, and it just
Right.
doesn't work.
Really great information. Thanks for spending some time on that. If you could give every active adult one piece of advice to stay healthy and avoid surgery later in life, what would that be? And man, I'm feeling this one, because my parents are almost 70 and my grandmother's 92, and I'm very close to her, but she's had hips replaced, knees replaced. My dad has one hip, one joint, another one, it's just like I'm seeing this happen as we age. So what's one piece of advice you would give to avoid that?
Well, I'm going to put 2 out there. One is, I would
Perfect.
say, stretch.
Okay.
As boring as it is, you can prevent a lot of injury just from stretching. The other thing is just keep moving. Keep moving, because, even outside of the orthopedic stuff, to talk about patients who get pneumonia or these lung issues, if you're active and you keep moving and you keep exercising to some level, you can prevent a lot of those things. The first thing we do after surgery, get them up, get them moving.
Yeah.
Because it's that important. And I still remember this. A good friend of mine, she's a physical therapist in a ICU in Mayo, and granted it's Mayo, they have, the resources are quite
Fast.
profound.
Yeah.
But but they did a study where in the ICU they got every patient up and moving, and they found within that study they decreased the ICU stay by 3 days to a week just by doing that simple thing. Now, granted, at Mayo they have the resources because she was telling me sometimes it would take 7 of us
Yeah.
to get a
To get them
patient
moving.
because all the machines
Yeah.
they're hooked up to, but that's what they showed is we just by getting them up and moving, just walking the floor, they reduce the overall stay in the ICU and survivability as well.
Yeah. Wow.
So
Movement is so critical.
yeah, because we do see a lot of people that get low back injuries,
Mhm.
and luckily a lot of them are, I don't say minor because they're pretty debilitating, but we can get them patched up fairly well. And it really is they got into an awkward situation or a movement, and the muscle just couldn't handle the stress because they're too tight, and it got to a break point,
Uh-huh.
and that's what threw them into the horrible spasm, which is affecting the nerve and everything else. And that's what I say, just stretch,
Yeah.
stretch your hamstrings, stretch your quads, all the silly things we learned in middle school gym class.
Yeah.
If you just took some time to do those things, and I say, keep moving, go for a walk. If you more advanced, yeah, ride your bike, get on a rower, go to the gym, but you don't have to be that involved. Just go for a walk. Just doing that, doing some stretching will keep you out of our office.
Free, simple, and easy.
Yes.
Just takes a little time
Yeah.
and discipline. And I'll share this too with listeners. I stretch every night. I'm very disciplined. I'm not as good at stretching after the gym because I'm usually like, all right, I got to get ready.
Yeah.
But I stretch every night and I have a routine that routine stretches that I do. And some nights I just don't feel like it. I just want to go to bed. But I do it because I habit stack it with okay, I brush my teeth and then I do my stretches.
Yeah.
So habit stacking with something that you're already doing.
Yeah. And I bet too, if you find if for whatever reason, you said you're traveling or whatnot,
Yes.
and you miss a few days,
Oh, I hate it.
you feel it.
Oh, I feel it.
You can
'Cause
tell.
I don't want to lay on the hotel floor when I'm traveling.
Yes.
So I don't always do it. I do it in the gym when I travel. I'm trying to be pretty good, but if I don't work out that first day I'm there or whatever, and I go a day, I can feel a major difference.
Yeah, you
when
can
I
tell.
haven't stretched. Yeah. So that's really good advice. And it doesn't, how long? I mean, 5-10 minutes.
Yeah. As I said, don't make it to where it's cumbersome or it
Right.
takes too much time. Just think of that. Just, 30 seconds, 3 times. Do your hamstrings, do your quads, do your calves. Just do all the little silly things. Like I said, we learned in
Yeah.
gym class or Google it.
Yeah.
You can Google some simple
Give me
stretches.
a 10-minute stretch.
You don't need to do a full yoga program for an hour and a half.
Yeah.
No, just, just like you said, pick like 5 to 10 exercises, 30 seconds, 3 times, just keep things limber.
Yeah. I always stretch when I pump gas too, which is, I get so many, people look at me like, what are you doing? But I'm just standing here. I might as well stretch. So there's another little habit hack for you. I love that. So what's the most rewarding part of helping somebody recover from injury and get back to doing what they love?
Well, I think you just said it, and that's part of the reason why I'm in orthopedics is because I feel in orthopedics, we can fix a lot of stuff. Like we can fix things where people don't even know they ever had it. And in some other specialties, that's not the case.
Yeah.
You're just trying to manage or maintain. Whereas orthopedics, that was what I really discovered as an athletic trainer is I can fix a lot of this stuff, get them right back 100% full go. Now again, there are things that maybe we can't, but we can make them better.
Yeah.
And that's the big thing, even, like you mentioned your parents, I get people that horrendous arthritis in their knees. I was like, well, I can't fix this, but I can make you better than what you are.
Yeah.
And that's the focus. So that and then educating people, that's the big thing I try and make a part of all of my visits because we don't get as much time as we did in the past. I mean, we're on a tight schedule. You got so much time to spend with those patients.
Mm-hmm.
So the more you can educate, the better outcomes they're going to have. And nothing irritates me more than like I'll see a patient and I said, "Oh, I just see you just went to the neurologist." What'd they say? I don't know. They have no idea about their visit. They have no idea
Oh my
what's
gosh.
going on. And, it's just sad. So I like to make sure that when they walk out of the room with me, they have an understanding of what's going on, what
Yeah.
the injury is, and what do they need to be doing to help make it better. Of course, I'm going to do some things to help them, but
Sure.
I want to make sure they have the tools to make themselves better.
Yeah. And I know you guys are always on, I mean, everyone's time is limited, but we've been patients of bone and joint, never felt rushed in any appointment. It always feels like every single person that we are, whether it's even the check-in, it's like you're
Yeah.
never rushed. They always want to take care of making sure the customer is taken care of, or the patient.
And even if we do, like I said, there are times when we're really busy. I at least will make sure give the patient the time.
Yeah.
Make sure you give them the time they need to, understand what's going on and the plan to go forward.
Yeah.
Sometimes, like I said, it doesn't take very much.
Right.
Other times it's a little more complex and you need to spend that time, and if you do that, then I think they're very satisfied,
Yeah.
with the care they got.
Oh, yeah. It's incredible. So looking ahead, what advances in orthopedics, sports medicine, or injury treatment are you most excited about?
I think it's, what you hear a lot out there, the biologics, stem cell, the peptides, all this stuff.
Mhm.
We're not there yet. And unfortunately, there's a lot of this stuff out already, but there's a lot of promise there, but we just don't have enough information yet. But everything that I've seen from the conferences I've been to the data I've read and seen is there's a lot of promise here. We just have to refine it and make sure we know what we're doing. With the peptides, they said, people say, well, what is that? It's like, well, there's all these GLP-1s, all these weight loss drugs. Those are peptides. But those have been well researched. We know what they're doing. But see, now, even with those, we're finding out, hey, this helps with heart disease.
No.
Hey, this helps with Alzheimer's. This helps with, addiction to opioids and alcohol. And we didn't know that, but the more we research these, the more things we're going to find these are helpful with. And there are many other peptides out there. Some people are using these for recovery and whatnot. Unfortunately, the only studies we have right now are animal studies. And to extrapolate what we find there into the human population can be dangerous. So we need more studies. We need more information. Like I said, the stuff's not FDA approved yet, but I think it will be. We just have to, make sure we know what we're doing, how to use it effectively and safely. And I think that will really help with overall recovery, injury prevention. And I think it even cross over into other fields as well. Same with the stem cells. Yes, right now you can go and get injections, but I will tell you that it's only half of, what that potential is there. There's a reason why you see the top orthopedic practices not using that yet because, the data is not there. And I think it's coming. I think within, my hope, the next 5-10 years, we will have this available to help with recovery from surgeries or even to replace some surgeries.
Yeah.
But it's a work in progress. So it's one of those things where it's very exciting because some of the things they are doing are amazing. But we're just not there yet to bring it to the populace. So stay tuned.
Yeah. More to come.
Yes,
I know that Bone and Joint is always on the cutting edge. So as soon as they feel like they're ready to use something, it's gonna be at Bone and Joint.
absolutely.
Yeah. The team there is amazing. Roger, where can we find you?
I am at the Nolensville clinic most of the time. We are open 7 days a week, so there's myself and other providers that fill in the gaps there. They're Monday through Friday, 9 to 7, and even on the weekends. That's a big thing that people don't realize. We are open 7 days a week.
Wow.
We're there 8 to 4 on Saturday and 10 to 4 on Sundays. So really useful for people that can't get to us those other days.
Yeah.
But yeah, usually that's where I'm at. Sometimes they'll move me to some of the other clinics, but usually I'm sitting in Nolensville holding it down.
Perfect. And there are lots of locations for Bone and Joint.
Yes. They said we do have our Brentwood office. We have our Spring Hill office, Thompson Station.
Yep.
And even at our main campus, there is an after hours clinic that you can be seen there as well. And basically these, they're labeled as urgent cares, but they are an extension of Bone and Joint. We have experienced providers at these locations, X-ray, and if it's something that's more significant, then we'll get you up to the surgeons, or we'll get the MRIs or whatever testing needs to be done and make sure it's taken care of. So,
Yeah.
and that's the thing. We're trying to unload all the surgeons so, they can get to the more severe, I guess, conditions, and we can keep people going and take care of the little things.
Yeah. And so if you have an injury, don't wait. There's lots of
Yes.
branches, lots of opportunities, 7 days a week.
Yes, and we're walk-in.
Right.
So yes, it's great if you can call and make an appointment, but we are walk-in, and we'll work you in if we're busy, and we'll get you taken care of.
Yeah. Awesome. Roger, I know how thrilled you are to work at Bone and Joint, and I also know how fortunate they are to have you. Thank you for being our guest today. That was our episode today was Roger Blandford who is a physician's assistant in orthopedic urgent care. Thank you guys so much for tuning in to the Lyndsay Stafford Show. Thank you for being my guest today, Roger.
Thank you, Lyndsay. It was great to be here.
Yeah, great to have you as our Bone and Joint featured guest. If you found value in this episode, and hey, if you know anyone with young children, this is a great episode to have them have you share with them, because think about what you might be able to prevent and also provide them some resources. Thanks for listening. Thanks for tuning in to the Lyndsay Stafford Show. Like, share, comment, rate, review, and subscribe. We'll see you next time.